Dementia and stroke are just two of the many conditions that require multiple appointments with a neurologist. But a new study by the University of Michigan finds many patients are traveling great distances to get the specialized care they need. And the lead researcher says that can hurt patients in the long run.
1 in 5 patients roughly have to travel a pretty long distance, greater than 50 miles, to see their neurologist. And so that indicates that there is a pretty substantial burden to patients.
That burden can make patients less likely to return for crucial follow-up visits, says Dr. Brian Callahan, a neurologist and researcher at U of M Health.
The longer patients have to travel, that can be very difficult for them, depending, especially if they're very disabled from their neurologic disease. But also, it might prevent them from coming to a second visit or a third visit, a fourth visit. And that continuity of care can be so critical when we're dealing with these chronic neurologic problems.
Patients in rural areas and those with diseases like cancer or ALS were more likely to travel farther for neurology appointments. 7% of patients in the study were even crossing state lines for an appointment. Callahan says there are more options today to increase access to neurological care.
One of the solutions is teleneurology, which is something that we're much more familiar with now after the pandemic. And so that can really make it quite easy for someone that would otherwise have to travel hundreds of miles to be able to see a neurologist in the comfort of their own home. And number two is the ability of neurologists in rural areas to communicate with specialized neurologists in bigger centers through lots of means like e-consults, phone consults, or other remote second opinions.
Dr. Callahan says many of those follow-up appointments are to make sure that patients are on the right medications at the right dosage and to monitor a patient for any changes that could mean a change in treatment that could be needed. Crucial care that they don't want patients to miss because of the burden of travel.